April 20th, 2022, 7 p.m. We'll call this Board of Health meeting to order. Is there anyone on for public participation? I don't see anyone.
See a soul.
Okay. So I guess we'll close public participation. Do we want to maybe approve the minutes?
Yeah.
I looked at them earlier. They seemed okay. Did you guys have any other thoughts on the minutes?
I think there was only, how does Melanie Deneen spell her first name? Is it, because it's spelled Mullane under
That's the
other
way she's-
attendees. That's it. Is
That's how she
it?
spells it, right? Melanie, right?
All right.
Cindy? I believe so.
Then I have no issues. It's just it got caught up on spell check.
You want to make
Maybe
a
we could.
motion?
Yeah, I would take a motion if anyone would be willing.
I just want to ask Anthony for Anthony, we're just going over the minutes.
Okay, sounds good.
In the health director's report, did you say that Body Works is now being regulated by the state?
No, so is that what's written in the agenda?
Yeah, so I'm a little confused. It said body work permits and regulations, but oh, okay, I got it. Massage regulations are now the state levels. They have been for quite some
Yeah,
time.
they have
Okay.
been, but there's been
Yeah, I wasn't understanding the comma. I got it. Never
right,
mind.
yeah.
I make a motion to accept the meeting minutes as they stand.
I will second.
Okay, all in favor?
Aye, Gorville.
Aye, Silva.
Linehan, aye. So moved. And then should we talk first about body work, or Anthony, do you just want to get into the health director's report, or are they kind of one and the same?
Yeah, so we're bodywork. It'll be a quick thing for us, just because we've been working on it for a while now. As you guys know, massage is a state regulated process, and they will do the inspections, and they're responsible for that. Hasn't been happening as much since COVID has started, and even now they haven't really started picking back up yet. I think that's due to a staffing shortage. But for locally, our body work facilities, we are looking to kind of revamp some of the regulations. We've held off a little bit because there was a bill, I believe it was passed by the Senate, it has to go to the House now, but we're going to be waiting on that because there's movement on that front in terms of what the state is going to allow us to regulate.
Oh, really?
So they're making some progress there. So before we set into motion some changes here and then have to do it again, I think it's worth keeping an eye on for now.
Yeah.
So until that point, I think we're just we'll keep you guys updated. But in terms of body work, we're gonna hold off a little bit for a little bit longer.
Okay.
Yep.
Anthony, are there any proprietors of concern? I've been hearing things about one.
So yeah, we've done a couple of inspections. We have we've done all the inspections. We have one more inspection to do. There's a facility on Albion Street that potentially does body work. So we'll check in with them to see if they still are. If they have their massage license, then they would they only do massage, and they'd be cleared by the state. We also have inspected a facility on Water Street. And so we're in the process of getting their paperwork in order. They also have things they need to correct, like their business sign. It's not accurate, doesn't reflect the business license with the town. So things like that, we do have to work with them to get corrected so that we have an accurate picture of it. But in terms of enforcement and inspections, it'll be difficult until we have some more clear regulations.
Mhm. Yeah.
Okay.
Any worries from the police trickling down back to you?
Not at the moment. We have been working close with police, and we want to make sure that we tie up any ends that we haven't really addressed up to this point. I know during COVID it wasn't one of our main priorities, but with police, we've already notified them, and they know what's going on. So we're just keeping them in the loop about our investigations.
Okay. Thank you.
Yep. Okay, so the health director's report, I know you've implored me to write this down, but we have only 2 items today. I'm going to briefly go through the presentation I made to Finance Committee, just going over some of the changes that we're proposing. And then I will also make an announcement at the end of the health director's report as well. So Cindy, do I have screen sharing ability?
Candace,
Oh.
Yeah.
can you give Anthony screen sharing ability since you're the host and I'm not?
I actually
Log in.
didn't, I didn't, I'm not. host.
Claim? Okay. So I have to go back into my email to get the host.
Yeah, I do
to-
too. Let me see if I can find that for you. I don't have the host key. Hold on.
Candace, why did
I'll
you
look-
just pop,
I'll-
you just popped
I'll
up
look
again?
too.
Yeah, I'm not
Oh,
in my
wow.
house right now. So I'm sorry. I'm on my phone and I'm on my Kindle. Let me see if I can try to help here.
You're doing a great job.
Thanks. Much appreciated.
We've always said we
Um,
needed 2 we needed 2 of Candace here, so.
Mhm.
Oh, isn't that nice? Okay. Let's see.
Anthony, do you want to make your announcements while we figure this out?
Yeah, that might be a good time. So today, Coral Hope, our senior health inspector, has announced that she will be leaving us in Melrose and Wakefield. She's been absolutely instrumental for many, many years here, making sure that all the regulations are up to date, that that we maintain good standing with all the businesses in town, and she works diligently with housing, and all the residents here. So she will be missed. She's been doing a lot of great work for many years here, and yeah, we wish her the best. Coral will be Coral's last day, I believe, is beginning of May. Is that correct, Cindy?
May 9th.
May
Where's
9th,
she-
yes.
Where's she going, Anthony? Do you know? Can you let us know?
I don't know if it's
Stole
official
her.
yet, so
Oh,
I don't know if the news is official yet, so I'm gonna leave that unsaid for now. Well, I'll let Coral kind of break the news on her own, but
Recording in progress.
very sad to see her go. She's wonderful. She was very, very good and very supportive this summer with me. Very, very supportive.
she is, and basically anything that's done, involves animal control inspections, everything up to this point, she's got her hands in it. So, but
A lot
she's
of positions.
yes,
A lot
but
of
she's
positions opened everywhere.
she's moving
Yeah.
on to a good opportunity. So we're all very happy.
Yeah, she deserves it. And knowing Coral, she will button up everything that she possibly can, because it's just like it goes against her DNA to leave anything unfinished. So I imagine.
Yes.
I imagine.
I mean, she's been working nonstop, the last 2 days just to help us, get that process started. There's a lot of institutional knowledge that's going to be going with her, but hopefully we'll be able to, absorb some of that by the time she goes.
Wow.
Anthony, did you put it in the network?
Oh, do you mean the slides?
Yep.
I did not, but I can send it to you.
Okay, because I can't get into my email, but I can get into the network. Strange.
Oh,
Hold on. It's because when I have to do Zoom meetings, I have to go off my computer and into just regular Google.
oh, so
You
Candace
can't do
has
both
host,
at the same.
does Candace have host abilities? Is that why?
Yeah, but I can get host is once I get the host code. And that's in my work email.
Okay. Let me see.
Unless
I
it
didn't-
ca- unless Catherine put it, she sent it to me in the email, but. All right.
You might have the most updated version. I'm not sure. So, and even if it's not, I can just talk through whatever changes we made. We didn't make a whole lot of changes from the last one.
All right, so what I'm gonna have to do is log out of Zoom to get into my remote desktop. So let me try that.
Okay, I just sent it to you by email, Cindy. It should be in there. Or I mean, I could even send it to Candace, and she could just share her screen. That worked.
But she didn't claim host, right, Candace?
She's still working on it. Uh-oh. we
Yeah,
lost her.
see, all right, hold on.
Okay.
Anthony,
yeah.
have you joined APHA yet?
I don't think I've signed up for it yet. Nope. I know it's a priority. Gotta get on that.
Got an email.
When does registration open?
That'll open up possibly in June. I'll be able to let
In
you
June.
know right away. I'm on the planning committee, so.
Oh, good. Okay. The perks of having someone on the planning committee.
Yeah, on the nursing path, we're doing a lot on the nursing. We're trying to recruit, but it dawned on me today. I didn't know if you had signed up yet.
I haven't signed up yet. I may. No, I don't think I still had my membership from grad school, but I think that's lapsed by now. I don't think it's
Yearly. It's a yearly fee.
It's a yearly
they
fee.
they want you to pay more, but I believe Wakefield and Melrose will pay for it.
They'll pay for him, yeah.
Yeah, they'll pay for it.
Might as well get it now because it only lasts for a year. And what happened with me was I did it like before the conference last year. So it's going to expire like right before the conference.
Oh.
I got to renew right away.
What is it, Elaine?
It's APHA, American Public Health Association. The
Right.
conference this year will be in Boston. And I want to say it's November. I have to look at a calendar. First week. It's an excellent thing. It's over 3 or 4 days, divided up nursing, environmental, public health, inspectors. Classes are great. It's great meeting people from all over the country.
Yeah.
A lot of there's CEUs for the nurses. If you take the nursing track, Laurel, you end up with probably 12 or 14 CEUs.
Yeah, it's never an issue.
Yeah.
And it's much better in person.
Oh, it is. Yeah.
Yeah.
Well,
I think, it's interesting because I'm part of the American Camp Association, and they have the Association of Camp Nurses, and they've just changed it to the Alliance of Camp Healthcare. So it's just much more inclusive. And I was running into some pushback around the protocols that we'll have for testing in a residential camp, and it's really blowing up how people have such opinions. And I have to say the executive director is handling it well. But I emailed the director of the Camp Health Alliance, and she was just really good. And then she said, well, if you're interested in co-authoring a paper either on de-escalation and kind of handling these different conversations, and I said, oh, she saw the big S on my head. But but it does occur to me, that really is, I think, why so many of us are so exhausted, because we just don't have the energy to be our better selves and to kind of stay even keeled. And it didn't even occur to me to think about using the strategies of de-escalation and really understanding some of the therapeutic skills that apparently I don't have in every domain. And I thought, so it would definitely have a cross-reference to APHA, so I keep my eyes open.
it open. I'd love to see if you ever get to. You could always do a nice poster presentation for APHA. That's still open, and
well,
those
it's
are
fine.
phenomenal.
Do you ever see
Phenomenal.
camp nursing come in? Because it's it's a microcosm of camp health and student health.
I don't remember one. I think I went 2 years ago because we haven't had it now for 2 years in person. But the in-person one was unreal. Looking at the poster presentations from all over the country, such a different variety of things in public health, and that's something that is part of it.
No, think about
I'll send you the information. We're always recruiting people.
it. Okay, where are we? We're gonna look at our fantastic
Got it?
FinCom.
Sorry, guys, I can't get into my email.
Oh,
My phone, it won't update. I have like emails from February in my Board of Health email, but I can't get into anything sooner.
okay. Well, how about you just tell us what you told FinCom?
Yes, I can do a verbal presentation.
And we can
I
all go
apologize.
back to the WCAT presentation and
Yeah.
No,
Yes.
it's okay. It was wonderful. Take my word for it.
Oh, thank you.
were you there for the whole thing?
Yeah, like the part, a lot of it. I mean, the part that had to do with us, they talked about a couple other budgets. But Anthony nailed it.
Oh, thank you. Yeah, it was a pretty long presentation, but it was just there were a lot of questions asked, some really good questions, and things that it's a good thing. We want outside perspectives to give us some things to think about how we can do things better. So, but I'll run through the presentation just based on the three kind of sections here. So we'll talk first about inspectional services, and then we'll transition into kind of more general health and nursing. And then we'll kind of then talk about social services and prevention. So that's kind of the structure that will go on today. Inspectional services, we started with food. So I tried to explain, in terms of the FDA code, how the risk-based inspection schedule works. And so from a very basic standpoint, there's 4 levels of risk, 1 being the lowest, 4 being the highest, and these correspond with the types of services that are provided. So a level 1 would be something along the lines of a convenience store that may only sell prepackaged foods. There's little to no contact with food handling.
Hey, Anthony, hold on. Hey, Candace, do you have background noise? You in a house?
I am. Can you hear stuff?
Yeah, can you just put it on mute while Anthony's talking?
Oh,
Sorry.
great. Thank you.
Those cute kids.
So cute. But
So level 2, the example for that would be like a catering business, or a business like a convenience store that may have like a heating grill, something with hot food there. So restaurants being, or standard restaurants being a level 3 risk, and level 4 risks being nursing homes and rehab centers, those that serve higher risk populations. And so the way we look at it is we took the number of those establishments by risk level, and you would look to do one inspection per year for a level 1 establishment risk, and then 2 for a level 2, 3, and 4 correspondingly. So we did 4 for like a nursing home or rehab center. We had 5 nursing homes and rehab centers and other risk level 4 establishments in Wakefield. So that puts us at 20 visits per year that we should be doing. And we had 20 restaurants that counted under level 3 risk level. So we had 60 visits required for just those. Level 2 catering businesses and others, those are 60. So we had 120 visits required. So on and on down the line, the total inspections ended up being about 242 total inspections that we should have done based on these FDA best practices risk-based inspection schedule. To put that in perspective, we also have other re-inspections. Re-inspections are obligated for us to follow up on. Those are different types of violations, and based on the violation, there's a certain time frame you have to revisit them. So we had 25 re-inspections that we actually went to. In 2021, we had 10 pre-operational inspections. These are inspections for new establishments, reopening establishments, those sort of things. Foodborne illness investigations, those we had 7 of in the year of 2021. That's an all hands on deck type effort, because it involves public health nursing, it involves getting in touch with the state, and it involves our inspectors to coordinate and figure out the contact tracing piece where this exposure could happen. So those are pretty time consuming. We had 16 food establishments complaints in 2021, and so with all those together, we totaled 300 total Wakefield food inspections. And so that's both the hypothetical, how much we should be doing, plus the ones we actually ended up doing. So 300 is the number that we should have done throughout the year. Based on the FDA's food code, the strategy 8 section talks about staffing and ability. And I think in that section, it says 280 to 320 inspections can be expected of 1 FTE per year. And so that's if there's 1 FTE only doing food 1 year, they can do anywhere from 280 to 320, which is a lot of inspections. And this is, best case scenario. Our actual food inspections completed in 2021 was 85. So there are, one of the questions that came up was, were there establishments that weren't inspected in the last year? And the answer is yes. We just didn't have the resources. And some of it's different because some restaurants didn't open immediately afterwards. And so there's some places that are close. So that number may not be as egregious, in terms of ones that didn't get an inspection that needed one, but it shows that there is a great need between what we can actually accomplish with staffing level we have now versus what is really deemed best practice by the FDA, right? So I think the 85 food inspections compared to the 300 that we identified was pretty eye-opening for folks. So after that, I wanted to put into perspective, besides food establishments, we can try to find somebody to just do food, but outside of that, housing complaints were 21% of all complaints that we received in 2021. Food was only 9%. And so we also deal with a lot of questions about trash, dumpster, yard, noise, odor, rodents, environment. All these categories all factor into a larger chunk than food in terms of complaints. And so, it's basically whenever a housing complaint comes up, it's usually a priority, right? It's usually something that we have to address outside of the routine food inspection schedule. And so this takes away from our ability to inspect all establishments. So I think it's important to keep in mind that we still have all these other pieces that go along with just the food inspections requirement. I see Cindy's back.
Okay, so
You can share your screen now, your co-host.
Oh. All right. There we
you
go.
have the host key and you are able to do it because I can't do both
Here
on
we
this
go.
laptop.
Oh, so pretty. We did it.
Wow.
Thank you.
Pretty
Ah, there we
colors.
go. Thank you, Cindy.
Sorry.
Now look at that.
That's okay. So I'll go back to the beginning and run through real quick. So this is what I was talking about before. Level 1, 2, 3, and 4. These are how we calculated those numbers to begin with. This is based on the FDA 2017 code, which hasn't been adopted by everybody, but this is something we want to move towards. I would anticipate that Wakefield would like us to, adopt the best practices when we can. So this is the best in terms of protective factor for preventing foodborne illness to do the prevention and education piece to prevent anything from happening. The required food inspections, this was the breakdown. So the 242 is pulled from the slide before in terms of ideally how many inspections we could complete based on the risk level. These are the re-inspections. So these are the ones that we actually had to respond to immediately. And then along with routine food inspections, we ended up only being able to accomplish 85 of those. And 300 is the magic number for last year.
Mm.
So this was the slide where I was talking about housing complaints as a function of how housing complaints as a proportion of how many complaints we received total. It took up a large chunk, but as you can see, rodents, environment, trash, dumpster, all those other things add up to more than the food establishment complaints and the housing together. COVID and businesses is a large chunk, and obviously this was a big piece of what we were working on, but it's not to say we're going to see the same breakdown this year. I don't have a crystal ball. I don't know what the fall is going to look like. We would anticipate cases going up, but whatever measures we put into place, it's going to be, it's going to have some effect on inspectional services one way or another. So I think it's good to keep in mind that these proportions will shift this year, but the total number of inspections we have to do will not. And if, and, you know, and it's possible it may even increase because we have new businesses. Okay. And this was just a final slide to show that this is how much the health department, you know, in terms of permits that we bring in yearly for the town. So everything here minus the animal permits, which I think we only deal with permits, but we don't do any kind of enforcement because we have our own animal control department. Everything else here we work on, specifically, you know, that's pools, camps, those are seasonal. Tobacco, we have Maureen Busby through the grant, so that's a little bit separate, but the rest of them, you know, funeral homes, tanning, food, body art, body work, temporary food for events, a septic well, those are all things that we work on. So it totals up to be 43,000 for the last year in terms of permits of how much we're working on. And I think that's the last bit for the inspections. Were there any questions about inspectional services, about?
No, it's just
Anthony,
super
has
helpful.
yeah, it's helpful. Anthony, has it ever been discussed? I don't think it's ever been discussed at like a town thing or anything, of just having your inspectors who did all your trash, your dumpsters, and things like that, like a regular inspectional services would, like they go out and do your housing, and your food inspector does your food. You know what I mean? He's straight, or her is straight into doing, you know, your stores and keeping up with that. Is that something that you've ever thought about, or has it ever been mentioned?
Yeah, so I mean, generally speaking, with the structure that we're proposing, so we'll have one full-time inspector in Wakefield and a half senior health inspector. Generally, the senior health inspector would be expected to have extensive background in housing and food. They would be looked to address the more complex cases, generally housing related. And then the health inspector would be tackling food for the most part. That would be ideally kind of how we separate that. And again, it would be a matter of coverage. So if something were happening in Melrose and the senior health inspector were asked to go out to, you know, a case, and the health inspector in Wakefield is available, it would be great if they had, you know, some kind of redundancy in terms of training, so they could also address, you know, basic housing concerns until at least the senior health inspector can step back in and work on that, right? So what you're saying makes sense. I think if we were able to separate that out, that would make it more efficient for us to just, you know, make sure all the food is done. Yeah, I think
That's what I came from. That's what I came from, was completely different. But we went in on, but you still, your health director and your public health nurses still went in on, you know, calls with them when they did to do certain inspections or, you know, things like that with it. I just wondered if that would be something. And you'll still keep a full-time inspector, right, in Melrose?
Yes.
Full-time
So,
food?
yes. So budget season has not officially begun yet, but in Melrose, we are looking to propose a full-time health inspector, and then continue the senior health inspector shared service. So we will have someone mostly dedicated to food, same thing as I just described. Hopefully they'll do mostly food, and then if need be, take on a couple of housing cases here and there. And at the same time, now that, you know, things have wound down a little bit, I've had a little extra time, I've been able to get caught up a little bit on mass fit housing and food. So I'll be able to, you know, also take on some of those more complex cases once I finish up my housing training. Okay.
You can unshare, Anthony.
Oh, this was just the beginning.
Oh, there's more. I'm sorry. We're just in the
Yes.
section. Darn it.
Oh, don't worry, I
Fine
got plenty
job.
for you.
Beautiful graphics. So sorry. I didn't realize we were pausing.
No, it's okay. And I want to say thank you. I mean, this is also, you know, Catherine put a lot of time and effort into this
Yeah,
as well.
that's
Catherine's been very helpful. I mean, this is kind of how we imagined it, having someone to also help with, you know, the operations piece, to help with, you know, metrics and everything. This has been, it's been helpful to have someone to do that as well. So,
So COVID's not in this?
for the presentation?
Well, it's not in the, so it's not in the stats for this.
Oh, no, so this was more talking about our need for social services coordination and
Oh,
prevention services. So we didn't necessarily touch on COVID for this section.
Yeah, it's also from 2019. That's why.
Yes, that's correct. This is the data that we have from the community health needs assessment from 2019.
Yep.
This is the third year, so they're working on the community health needs assessment for this year, but it hasn't come out yet. So some of the numbers will have shifted, but we are seeing here Wakefield in these areas are this many percentage points higher than the state average. So it's something to keep in mind. Like we've always been saying, COVID was all consuming, but other things have been going on,
Yep.
continuing to go on. So it's pretty eye-opening to see some of these statistics. And one of the things that I wanted to point out, so prevention really is about education, working with different organizations to see if we can get this information out there and maybe inform on programming, right? What we should do to address some of these issues. But this last one is also social service related in terms of SNAP. And so a lot of folks will reach out and say, hey, why aren't we utilizing the resources that we do have? And this is one example. SNAP is something that, a service that we can utilize. But as you can see here, I believe the gap, so the state average is about 40%. So 40% of individuals that are eligible for SNAP are not signed up for SNAP or not utilizing the benefits. In Wakefield, the percentage is about 63%. So 63% of the eligible population for SNAP in Wakefield are not utilizing SNAP. So it's important to kind of understand that there is a gap in terms of what's being accessed, and this is something that we can address a lot through the food pantry. The social service coordinator would specialize in working with folks on the intake, figure out what their needs are from a food insecurity standpoint, but also other things that may be going on. They can also help address that at the same time. So this is kind of a metric that is able to point that out. So the public health nursing, so we had proposed a half-time assistant public health nurse position that would be Wakefield specific. They would work with Melissa to address a lot of different cases of other diseases besides COVID. We have plenty of other infectious diseases to deal with. And so I think it's important to point out that throughout this whole thing, Melissa has been able to, as one person, help coordinate a lot of these COVID clinics. The regional ones were prior to myself and Melissa, but COVID clinics in the fall, the flu clinics. She continued to work with individual on the shingles vaccine, and she's been, when she's been able to find time, address data, inconsistencies and MIS, but at the same time, there's a lot of things that we could be doing other than that. So the prevention piece, and I'll kind of move on to the next slide so I can explain this. So, how we see public health nursing kind of in this role is health promotion. So, this is training, CPR related, choke saver. This also works in disease prevention. We have plenty of tick-borne illnesses that I'm sure will pick up in spring and summer. It'll be interesting to see what the trends are there. The summer camp inspections, those are part of summer camp in general is a bigger piece for us in the summer because we have inspectors and public health nurses getting involved. And I think, all of these things all point to something along the lines of a health maintenance. So that's blood pressure clinics, that's, educational things for senior living centers. And that's, so there's a lot of different pieces that a public health nurse can work on. And I think working as a team, I think Melissa and a public health nurse assistant could address all of these for Wakefield. And so the last kind of piece here we're going to talk about is the social services needs. And so it's very difficult, I think, both in prevention and social services needs to really quantify, exactly how the impact is seen. I think it's really just looking at, the areas that we already have and that we know are struggling, and then we can try and work on programs and staffing that might address those. So a lot of folks didn't know that we have, 1 out of every 22 residents in Wakefield falls below the poverty line. This is something that we haven't really, that most people, when they look at it, are shocked by, right? We don't usually talk about that, but that is the case right now. I think it's important to understand that in FY20, the food pantry had served 821 households. This number may include some folks from outside the area, but generally it was Wakefield residents. These are whole families that are benefiting from these services. So it shows that there is a need for what they do, and they have a great reach into the community. They are the access point for a lot of folks, and so if we can expand services that they can access through this person, that would be great. In FY20, the difference from FY21 to 20 to 21 in terms of mental health related calls by Wakefield police that responded to was an increase of 87%. This is a huge change. We'll show the numbers in the next slide, but this is a huge change that we saw coming, right? We knew that the pandemic was going to have an adverse effect on mental health, and just in general how people cope with stress, and so this is definitely a pretty important statistic. And the state suicide average versus the Wakefield suicide average was just under double in terms of per 100,000 rates. And so this is important to understand that a lot of our more vulnerable citizens, that's the youth, that's seniors, but also our general population as well. Different pockets, will have different struggles, and so we need to better understand how we can cater our resources to them. And then the last statistic was pretty interesting, and it's something that I don't believe we've looked at before, but it's important to understand that we also have a point of contact, which is through a lot of these housing complaints that we respond to. 60% of them actually had a social service need identified. And up to this point, Coral has been doing a great job of basically acting as a social service connector along with being an inspector. But that's a lot to take on, and it takes away from the other responsibilities of an inspector, right? So I think moving forward, it's important to have collaboration between inspections and social services coordinator, where they can go out with them on an inspection and at the same time address, if there's an issue with hoarding, or there's an issue with not accessing something that elder services may have resources. They can easily do that connection so that things don't get worse over time. And this is just kind of a recap of the social services needs. And so we can see that the mental health related responses, there was a huge uptick between FY20 and 21. And domestic violence related calls also increased drastically in the last year. And so I think it's important to understand that, this increase is very real. One of the suggestions during finance committee was, can we break this out into high utilizers? And this is something, that's a trend, in healthcare as well, high utilizers too. But in all senses, we are seeing an increase in unique users as well. This is not a trend only driven by high utilizers. And so that's something that we want to get across, is that we'll be happy to break that out, but I think it's important for folks to understand that this increase is very real, and that if we don't address it, this is something that we can see getting worse over time.
Well, and I feel like focusing on high utilizers will split both ways, right? So if you invest in services, it's the ultimate argument about prevention, saying, well, yes, if you can't meet these needs, they're going to keep calling. So, I think we just have to be so careful, because there's a stigma potential there. So we just,
absolutely.
I can imagine, it's pretty enlightening. I didn't realize some of these numbers. I didn't realize our suicide rate was above. And certainly it's interesting to know on the mental health comorbidities. We have people who die from suicide, but also substance use disorder, which goes under that, but also the treatment for the most complex mental health disorders give people, a short lifespan. So that's pretty telling. Good
Yeah.
job.
Anthony,
think- yes.
when we show our numbers from like the overdose cases and the suicides, where do we get our numbers from? Like your overdose, do those come from Melrose Wakefield Hospital? How many they've had?
So I think we pulled those numbers from time to time, but we don't have regular communication. So those numbers do come from Melrose Wakefield.
I thought they also came
But-
from death certificates, no?
Yes, and we can also get them from death certificates as
Okay.
well. But generally, we do try to work with Melrose Wakefield on that as well. And I think one of the things that we can work on, something that I've worked on in the past, is when we've established, back in my old position, we worked very closely with all of the service providers, the three main hospitals in our catchment area. And one of the things that we worked on was ER data. And so we would take, I can't remember them now. I think they're ICD codes. We would take the ICD codes, and we also take chief complaint text, just the free form text, and we would do analysis basically on, what was the initial what was the initial condition that was brought into them, what was identified, and then how much of that was drug related, and how many were released, and then so we were able to get a better picture of admissions, and not just overdoses. And so that gave us an interesting insight into what the community statistics were actually related to that drug use.
Mm.
So something like this, Melrose Wakefield is one of our larger providers. I would say some folks still will go to Winchester or Leahy. So it's not like we're going to have a perfect picture of what it looks like here in Wakefield or even Melrose, but I think it's a good starting place for us to look at.
Well, and we have, with Wake Up, we have, the Melrose community outreach people are often participating in our meeting. We have in the past gotten the community assessment information from Leahy. Winchester's part of Leahy now, right?
Yeah.
Like,
Is that okay?
so, it's good to understand what's in our catchment area. We have so many people who just go to Boston. And so
Yes.
it is tricky, but there must be a way with the state to, pull it out by zip code. So I leave that to you, the epidemiologist, but we need grad student to keep follow this stuff.
People like to point out that I'm an epi, and I would like to argue that I would love to do that, but I don't have the time.
I know you're not able to, but you know what questions to ask to guide
Yes.
somebody to do it. So that's, I know you're excelling in management.
Thank you. But it's a good thing you point that out, because we actually have some good news. So we applied for the Mass DPH summer internship program,
Okay.
and both Wakefield and Melrose were accepted.
Okay.
So we are potential landing spots for grad students in public health, and I think it would be a great opportunity to have someone to come in and really explore the public health field, find what they're interested in, and potentially work on some things that are going to be help us.
Well, and you could definitely, and Melissa as well. Well, everybody. Then you got a bunch of MPHs in the department, but
Oh yeah.
if you can just single out the get this data, and make it meaningful to them, could be a win-win. That's awesome.
Yeah, I think so. I've already had a couple conversations with some interested students. Some are undergrad, some are grad students, just interested in a potential placement here with us, and we have capacity for that. We have folks interested in substance use and prevention. We have great resource in Catherine doing that. In inspections, we have people who are interested in that and how that kind of reflects. And we're looking to dive a little deeper into public health nursing, and hopefully getting more nurses interested in the field, right? Because it's a different route than a traditional route, but I think it's important for us to get that out there as an option.
Cool.
Yeah. So I think it's important for us to work closely with Melrose Wakefield to get some of these numbers that these are pretty telling already, but I think it's good for us to talk more about what we find.
So just to rewind a little bit. So this presentation really was to defend the budget and our hope to become HHS. We're not calling ourselves Health and Human Services until after town meeting. Is that, or fiscal, like, when are we changing our name? Have we already?
I believe it's already happened. In the budget that was submitted, it said Wakefield Health and Human Service. I think before it said Wakefield Board of Health, even though that's not correct.
Yeah.
It had been like that for years, and we had changed it. So I think the budget that was submitted was already Wakefield Health and Human Services.
Oh, okay. Because
Yeah,
I'm a
so I
little,
think,
yeah. Well, I'm just a little concerned. We're having a little PR snafu based on 5 Common Street and based on nothing that had, things that had nothing to do with health department decision making or Board of Health decision making, but things, it looks like escalated in regards to some movement and whether it was fair. And so, it just caused a lot of noise in the public pages. And again, it popped up in the local paper. And so I just want to be very careful about, not assuming this growth until that budget is passed by town meeting.
yes, and I think it's important that we keep that in mind. I mean, the only thing that has changed up to this point is our department name. Any changes to personnel titles, to promotions or anything related to that is not official until town meeting.
Okay.
So everything is staying the same until further notice. So May 16th, if our budget is approved, so town council, finance committee, and the public, when they vote, until all that happens, we are still Wakefield Health and Human Services, but any of our positions are still the way they were up to this point. So
I think it's just very important optic, never to assume and to
absolutely,
and to continue the groveling stance until the last vote is cast, basically. So we'll be there for the May meeting. But great job. I think, and I think it's so good to look at this too, because it's, we've just been so swamped with COVID.
Yeah.
And, it's really great to just remind people what public health really is about.
I think it's good. So just a couple, I mean, this was really just to defend our case. But here, I think the other stuff is pretty self-explanatory. You guys know this already. But I think it's important to point out that we did a few a bit of number crunching. So we had 39, heroin and opioid overdoses, 10 were fatal. We continue to identify alcohol as an issue in Wakefield. Not unique to Wakefield, but it is still an issue here. And we also pointed out, from a cost standpoint, it makes sense for us to invest in prevention, right? Prevention and harm reduction are the places we need more help, because based on, so this number right here is based on the state total that they spent, and then based on our population, this is how much was spent on substance use. And actually, from our standpoint, we actually were slightly higher than the state average in terms of substance use disorder rates. And so this number is actually a slight underestimate of how much we spent, and we, based on the percentage that we used on law enforcement, treatment and recovery, those are the lion's share, right, of how much we spent on substance use in Wakefield on an average year. But hopefully, if we invest in prevention and harm reduction, this will save costs in the future, so we don't have to spend as many, resources on responding to emergencies from fire and police side. So, there's a lot of concern about sustainability. We don't want to just, create positions just for the sake of creating, and then, have to absorb them in town budget without any kind of rationale. But, in the long run, these positions in prevention that we're investing in will save us money down the line. So.
Oh, wow. That's big. So I'm a little confused, because it sounds like you had 3 FinCom meetings. It sounds like you had a subcommittee.
Yes.
And then the full committee on just the budget, but then you got pulled back to present this?
So from what I understand, the subcommittee is kind of the initial presentation. They're supposed to take the information to the full committee before our next meeting. And then we have a full committee meeting where we talk about the budget.
Yeah.
I don't believe anything was voted on at the first finance committee meeting for any department, not just us. And then the finance committee meeting last week, was the one where they would discuss the budget, any other questions. My presentation ended up just being helpful, to explain things.
I just don't recall being pulled back to do that. But you're awfully popular, Anthony, and you can't seem to resist a meeting.
Yes,
I think a lot of it in pulling back was, I think we have to realize that these towns and cities haven't actually, I mean, they've passed budgets the last couple of years, but I think the needs have increased so much that they're really trying to see what they have to fund, how they
Yeah.
have to increase it. I think that's a lot of it, but you're right, Laura. We only used to have that first one.
I'm
and then
just
the
a little
second.
confused. It was just like,
Yeah.
subcommittees didn't happen till maybe 3 years ago. I could be wrong. So, we've gone from one presentation to FinCom and one presentation to town council to now 3 presentations to FinCom. So, they're busy. This is great. Wow.
Really great job. It's beautiful.
I'm tired. Cool.
All right, well, I'm done with my part of the presentation, but if there's any questions, definitely.
Once this is approved at town meeting, you will then advertise the new positions. Am I correct?
That is correct, and obviously they'll start, the new fiscal year, but we can start
Yeah.
advertising right after town, if we are passed in town.
Wow.
Anthony, you're going to have a heck of a lot more positions to fill than I did.
Yeah.
I think I've
But
told Cindy my favorite part of this job is hiring.
Hiring? Well, that's why we hired the right person for that spot,
I
Anthony.
know, that is fun. And also we have another shift, right? Melanie is that official?
Yes, so Melanie is leaving us. Her last day is this Friday. The shared service grant is currently hosted at Wakefield. There are discussions about a potential shift in fiscal agent. So we may be potentially shifting it to Melrose as the fiscal agent, but nothing is official yet. We're still waiting on word from the state to see if that's possible, but I don't believe there's going to be any problems with that. It's just going to be a matter of changing a few administrative pieces. And that changeover will most likely take place by the new fiscal, along with the new fiscal. So it keeps things a little bit cleaner.
Wow.
Yeah.
Okay.
So we are losing Melanie. Again, a valued part of our team. We'll be missing a lot of that experience that she brings, but she is also moving on to a great position. I think this is public knowledge now, so I can say it. She is going to be the new health director in the city of town of Concord. City of Concord. Okay.
Concord?
Yes.
Town.
Wow.
Concord.
Ooh, that's pretty. And she lives near there.
Yes. So I don't think she does, but
She's the opposite end.
Is she?
Yeah, she's more not
But,
this way.
Okay, never
But
mind.
again, this is one of those things that we're very happy for her. She's going to be a great resource and asset to them. But we'll look to kind of restructure. The shared service grant has had its bumps here and there. There's always restrictions that we're running into with the state, and so we'll hope to have a smoother time with it in the year 2 of the grant. So.
Anthony, how many years was our shared? Is that for 3 years or for 5?
It's a 3-year grant, so we're entering
Okay,
year 2.
this is our
Yep.
second, right? Okay.
This is our second year.
Better for the first third.
Yep. I
Looks
would
like we
say,
had it for 30.
yeah, I would say the first third of the grant has been, has mixed results. I think we've accomplished a lot of good things, rodent related communications, and all that stuff, all the materials that came out of that, and some of the policy that we ended up generating from that has been very helpful. That's been great. The inspections piece continues to be a challenge. Finding someone that will be able to coordinate so they don't burn out, having to serve all these communities. It's not really a shared service in the sense that it's equal for everybody, but it's going to be like what areas that we can address for folks that are in need. So it'll be a struggle to maintain moving forward, but with the state acknowledging that we have an issue in terms of staffing in the state, with inspections not being a really easy route to follow. The state is starting to consider forming hubs for training new inspectors, and we are on the short list of places that are being considered to become a training hub. So we'll keep you guys informed about that. But it would be a good thing, I think, to bring in some new faces, have that program, and I think the state will benefit from that as a whole. So.
Cool. Hey, I have a question, getting back to your original presentation of public health. Are we able to offer shingles vaccinations or not?
I believe we are able to. Melissa, and correct me if I'm wrong, Elaine, Melissa has actually provided one in our department, I believe.
Yeah, that was from the last round that we got it. You have to purchase it. And
Right,
then
I had a constituent ask me, again, are you still the public health nurse? I said, I've never been the public health nurse, but I'll ask the public health nurse. But I know one.
I think she was going to look into it again, because a lot of it is getting the access to it and then setting it up, because it's that 2-shot series and whether or not somebody's insurance pays.
And this person's insurance was stingy, and I was kind of surprised. I was like, whoa, it was a Medicare Plus, and that is the cohort that needs that vaccine the most. And
that's surprising to me that wouldn't be covered.
Yeah,
it's covered to a point, Anthony, because I was just asked to get mine.
At least it was over $100 copay.
Yeah, it is. It almost reminds you of when they did the meningitis years ago. Remember, you could get it sent to the pharmacy, and if you picked it up from the pharmacy and then you brought it to the pediatrician's office and they administered it, you didn't have to pay that big copay. But there it is. But if a primary care, if they're going in through some big like Leahy or something, they have a big vaccine unit, and if you go through usually them, that's where you're not getting as much of a copay, I've heard. But if you're going through the local, CVS and stuff like that, they're advising you to make sure that you definitely check with your insurance company, because the copay can be very, very high for people. And that's why, your local helps, but it all depends upon, whether or not you're a normal vaccine. And since COVID, everybody has kind of lost everything. We have all our training now.
Well, where are we? So, speaking of copays, where is Massachusetts in regards to COVID-19 PCR testing? Are we, have we completely given up? Are we, is it pharmacies only? Do we have any sense of people getting dinged with copays because it's not coded correctly?
So actually, Elaine, you might be able to answer this better than I will. The testing, I don't know about that too well, but I do know about vaccines. The 4th dose, people, insurance has been charged for the 4th dose booster. So, but testing, I'm not so sure.
Your PCR, your state has shut down majority of them. There's only like 2 or 3 that are around here. But you need now, in order to not really get charged, you need an order from your primary care. That's you people, Candace, who have been so good to call them in. I've recently had a couple of experiences with them, and you really have to, even if you call and you say, yeah, well, I did a home test, but I still would like the PCR. It's kind of hard to convince a lot of primary cares to say yeah and send it, and they think about it. But they are doing them, but they're very, very limited. But if you go anywhere for PCR tests, you're not waiting in line. Let me tell you, there's no lines.
No, I know, but summer camp seasons are coming up, and some protocols include pre-testing, and I think we just really have to be aware of the environment that we're asking people to be in. And I don't want surprise costs to come up.
Is there any wiggle room for camps and in terms of PCR testing?
I doubt. Unless you use your own lab, I haven't found any. It's a very different than it was a year.
So they're pretty set on PCR testing.
Are they definite?
No, actually, it's to each his own, which is even more difficult.
Oh,
So, it's, do we accept antigen tests? Do we do PCR before, there's guidelines. So
We're
it's
doing the camp guidelines for vaccines in May at the MAPHN. I'm going to ask Laurel about that because that's a lot of
Yeah.
the DPH people are doing that. I'm going to ask that because I found that it was very difficult to help people to try to find a place to go to get a PCR.
Yeah.
And are they being reported right? We
Yeah.
all had a little bit of problems with Maven and you're not reporting a home test. So
Yeah.
what's really going on, with travel? So.
Yeah, I'm concerned with the environment that we're
Yeah.
asking. So.
And it is expensive. You're right, Laurel. It's expensive. You're talking about over $200, and that's a lot of money.
Well, it shouldn't
know,
be. I mean,
yeah.
it shouldn't be. That's a huge markup. And, people who tell me people are making money on this, I say, no doubt. It's not me.
But there
It's
is,
not the game.
I will send you. I know of one that they don't. I don't think they even ask for your insurance. It's one of the testing sites that's open pretty good. A couple of other you can't even get in unless you've got an order from a physician. They won't let you pass the door.
Yeah, well, the testing sites have been great, but they're few and far between, and they're
Yeah.
not near us anymore, I don't think. So
Just
I'll look
one.
into
There
it.
is one near us.
Where's the
Just
one?
one.
That's
In
good.
Everett. Everett still has one. They're one of the only ones left.
Yeah.
The Square One is closed now, I think. I think
Yeah.
they're gone. Yeah.
I think
Yeah.
so.
Yeah,
Yeah.
it's in Everett. I can get you the info and send it. I'll have her send it to me.
I can find it. It's all right. But thank you. It's just so we've evolved, yet we're kind of throwing the baby out with the bathwater. This whole, federal judge saying, this isn't constitutional, and people are like, okay. I'm like, well, we didn't say it wasn't a good idea. And we've just lost it with masks.
Very confusing. And I don't know, Candace, you probably have an insight more on this. It was very interesting to talk to like primary care offices about people who had tested home, positive. And why did you want to go for a PCR? Well, let's think about it. This person has multiple, underlying conditions. So don't we really have to make double sure with that PCR and have that on file and have that accessed? And they think you're cuckoo. And I did get said, what did someone say to me? You're very strict when it comes to public health policies, aren't you?
Yeah, I hear you. We're lucky enough at East Boston, we have like on-site testing still. We've definitely scaled it down, but we have on-site testing available. But it's rare that we even use it. I feel like we put a lot of stock in the home tests, and they're so readily available. And most of the time, the positives are kids that are testing for school reasons and stuff like that.
Mm-hmm.
And we just we have a clinic where we do testing ourselves. So, like every afternoon, there's one provider in the office that sees potential COVID patients, and we just test right there. So we examine them, test them, and then we'll do a rapid. And if it's negative, but we have a high suspicion, we'll send a PCR right there.
Gotcha.
So I wonder also directing folks to go get an exam with their primary care site. Because maybe it's something else. It's flu's out there.
I know.
Right, it is. Yep.
And we have no more flu vaccine.
Don't.
No, we have no more. And we're not getting any more. So good luck, everybody.
Ask around to your public health departments. They may
Okay.
still have it.
Well,
Most of them have it
we've-
in June. Till
we've
June,
had to
we have it.
squirrel away a tiny bottle that we're really just using for kids. But I mean, I know we're getting to the end of the season, but we still have cases. We definitely
We
still
have flu vaccine, Anthony.
Yeah.
I think we probably have a couple left over. I don't, yeah.
We
that's-
have
yeah.
some.
Yeah,
We have some left over, yeah.
I'm coming
Yeah.
by tomorrow for it.
you're gonna have to put that in color and make sure that
We're
comes out in the
being recorded.
inventory.
Yeah.
It's a hot item. It's a hot item.
Yeah, it is.
Interesting.
And usually at this time of year, we're getting ready to dump it. It's sad, but
Right.
Yeah.
I
Well,
know.
it wasn't the efficacy for this year. It wasn't. Yeah. So I'm not. quite
Oh,
sure.
you know what? Was it or wasn't it? And how many people skipped their flu shot this year? Do you know what I mean? Especially in the
People
younger
just weren't
children.
coming in.
Yeah.
Yeah,
I
people
think
just weren't coming in.
I think we ultimately did more than we normally do. this
Yeah.
year.
We did,
We
yeah.
did, we did, we
Anthony
did do
kept
quite
making
a
us
few.
do pop-up clinics. It's his fault. And we were like, oh, for God's sakes. Okay.
That's
Laurel's
what it
favorite
is.
part.
The more hours you have available for flu, the more you'll use. That's why we used as up, because we were open 2 nights a week. There was always a nurse on duty there. Someone always came in for a flu shot, always, and you got rid of it, as much as you can. But maybe if everything goes right and we got that new half a nurse, that makes a big, huge difference
Oh.
to provide
think it-
services.
I think it will.
When's our next meeting?
May
Uh,
18th?
Wow, really?
18th?
Hold on,
When's town meeting? The 26th?
the 16th.
It is right
I
after
agree,
town meeting.
Cindy. I think, yeah, the 16th is a Monday, the 18th would be the third Wednesday.
I will not be here. That's our MAPHN conference. I'm positive.
I could do 11, but I can't do 25.
Unless,
Why can't we do 18? Wait a minute, 1, 2, 3.
Elaine's not
I'll
gonna be
be
there.
at the conference I can check the schedule to see if I somehow could leave, because we have an evening program. We have Wednesday program and Thursday program all day. And I know we have, I'll have to check just to make double sure what the schedule is, if you want to schedule it, and then I can see.
Unless we
We
want to,
could've-
I'm fine with the 11th because the 25th does not work for you, Candace, right?
That's right, but 11th would be also fine for me. Anthony?
Oh, okay, I was just saying 11 or 25 is fine, so 11 I think 11 is gonna be okay.
Okay, Elaine, could 11 work for you?
I'll make it work no matter what. How's
And then
that?
may-
Okay.
and then maybe the 15th of June, and then maybe we can take July off.
In August?
Summer vacation.
Okay,
So we're gonna go with the 11th? Or do we want to wait, Elaine?
let's do 11 for now.
Okay,
The 11th, I can let you know right away tomorrow. I'll look back into the schedule to make sure I'm right.
all right, I'll text you because I have to book the room, so,
Okay.
all right.
And we're
perfect.
thinking in person, everybody, next meeting in person?
Would be nice. And then let us keep it informed of, if you're gonna do anything for Coral.
Yes,
I'll come
absolutely.
by the
I'll-
office Friday for Melanie.
Yeah, we'll make sure to do that. I think, we're actually doing a little thing for Melanie tomorrow morning, but I don't think.
Oh, okay.
Yeah.
All right. Now the public knows. Well,
Cool.
that's what happens.
Anything
when you
else?
have high-end people, they get recruited. Started.
Yeah. Hey,
It's a-
but you know what? It's a good thing when people get to advance. And,
That is, I'm happy for them both. That's awesome.
They spread their wings, right? Anthony, I told you, they spread their wings and they
Absolutely.
take with them what you taught them. And everyone will say, look at where they came from. Wow, they're really good there.
Yeah.
All right.
Okay,
I could take a
take a motion.
motion to
I'll
close.
make
if-
a
unless there's
motion
anything
to
else.
adjourn. I'll
I
make a motion
second.
to adjourn.
I'll second.
All in favor?
For
Gordon,
aye?
aye. Silver eye.
Linehan, also aye. So moved.
All right, everybody.
All
okay,
right,
good night.